every human being, whether they're 4 hours old, whether they're 100 years old, has an innate wisdom inside of them. It's a natural, normal thing. It keeps their heart beating. It keeps their lungs breathing. It heals a cut on the skin whenever you cut yourself. And it's within everybody, right? Hello and welcome. This is Dr. Pablo, and today we're going to be discussing a few things. What is healthcare? What are the different healthcare avenues available to you? And also, when does it make sense to utilize one over the other? Okay, there are a lot of mistakes that you and I have made, we have all made, as far as what we interpret the word healthcare to mean in actuality. And it's led us down some interesting paths, right? So today we're going to clear it all up and we're going to make it make sense, right? Now, as a person who grew up in a very medically minded family where doctors were used not when you were healthy, but they were actually used only when you were sick, and whatever the doctor said, the doctor's word is law, who is now a doctor who helps people in a non-medical way. I think I have a fresh perspective, maybe to shine some light on things that we haven't considered, right? So let's just chat about where we're at, right? Let's pause for a moment and analyze, right? It's 2025. We are in a post-pandemic world. You and I, we all went through it. That was a fun time, but what with all the vaccines, whether to take a vaccine, whether to not take one, are they good or are they bad? Pandemic really exposed all of us. Now, a lot of political tension generated from that. We've got CEOs of health insurance companies being assassinated. You either love that or you hate that. Pharmaceutical companies are wealthier than ever before. And meanwhile, we have Robert F. Kennedy Jr. advocating to ban food dyes and fighting to make America healthy again, right? So this is the climate that we're in. The climate is ripe for change. There is a lot of minds changing, a lot of eyes opening up as far as the meaning, the standard, and ultimately the implementation of what healthcare actually means, right? So considering the context of where we're at, where we've been, right? Let's pause, right? Pause for a moment. And let's analyze some cold hard facts, basically about where we're at today with our healthcare, right? Particularly in the US. Now, start off with number one. The United States spends more on healthcare than any other country in the world, but it ranks lower in life expectancy and higher in chronic disease than other developed countries. Okay? 2, 6 out of 10 American adults have one chronic disease. 4 out of 10 have 2 or more chronic diseases. 3, the United States accounts for 40% of global pharmaceutical spending. 40% of the spending on pharmaceuticals in the world is done in the United States. And 4, last but not least, medical error is the third leading cause of death in the United States behind heart disease and cancer. It's a lot, right? Let's just let that sink in for a moment, right? How in the heck did we get here? Today, we're going to discuss some of the mistakes that you and I have made, as well as identify some possible solutions and changes as far as effective and efficient healthcare for you and your family, right? And it really does start with you, the individual, right? Educating yourself, empowering yourself, equipping yourself to make sound decisions. If we knew better, we would do better. And that's ultimately what this podcast is all about. So, one of the key mistakes that we've made is to hold equal or to think that it's the same thing, the words healthcare with the words medical care, right? That's one of the big mistakes that we've made. It's been a fatal mistake that society has made. ultimately leading us to those very revealing statistics that tell us what reality, what's actually going on. Now, the bad news is we have made mistakes. But the good news is it is not your fault, and we can make changes. We can do different things to generate a different result, right? Now, there are many reasons why we've made this mistake. I won't go into all the details, but if you would like more information on the powerful influences, the special interests on your healthcare beliefs, on medicine and medical practice, as well as curriculum in medical schools, you should look into or Google it, research it, the Flexner Report of 1910, which was funded and backed by the Carnegie Foundation and the Rockefeller family. All right, I won't go into it, but you can do your research and just maybe you might see how perhaps there are some interests out there that benefit from this mental mistake that we've made. But the point of this episode is for us to correct paths, right? To change paths, perhaps consider a different path, and for us to resolve the mistakes that we've made, right? So we've made the mistake of thinking healthcare and medical care are the same things. Right now, let's go over a definition of healthcare that is perhaps more applicable, maybe more empowering, maybe more practical, right? So, healthcare, right? Healthcare is the ongoing and intentional practice to support an individual's well-being through conscious choices, habits, and environment selection. Okay? Now notice, it did not say anything about medical care. It also did not say anything about chiropractic care. So you cannot say I'm biased. But there's some key components to that definition, right? Let's talk about it. Those components is proactive responsibility, right? This is really accurate as far as proactivity goes because healthcare, it's a continuous everyday thing, right? Every morning you wake up either a little healthier or a little bit less healthier than you woke up the day before. And this is pretty accurate because when you consider chronic diseases or poor health, it did not happen overnight. Typically, health issues occurred over days, over weeks, over years of somebody slowly but surely losing their health, right? So it's a proactive thing. There's the second component, which is responsibility, right? This is really accurate because healthcare is not something that is done to you. Healthcare is something that you do for yourself, right? It's something that you are in charge of, right? You take care of your own health and you take care of your family's health. This is highly practical because there's no organization out there, there's no doctor out there, there's no group of people out there that is going to take care of your health as well as you will take care of it, right? And so when we consider this definition of healthcare, I'll go over it one more time. Healthcare is the ongoing and intentional practice of the individual to support their well-being through conscious choices, habits, and environment selection. Okay? Maybe a different way of thinking. If this resonates with you, perhaps it's a revelation to you as far as what kind of health care do I want? You know, am I going to leave my health in the responsibility of somebody else, or am I going to take action into my own hands? Now, for one reason or another, we are all intimately familiar with the traditional healthcare approach. I know I am, either directly or indirectly, right? We've all participated. Now, the question I'm eager to dive into is there something different, right? Is there a different school of thought, a different service, a different provider that can get you to where you want to be or that you resonate with more? Does it exist? I'm here to tell you, yes, it does. And so I'm going to be explaining a couple of things here. Basically, the two different schools of thought when it comes to healthcare, the two different approaches, philosophies, applications, whatever you want to call them. The approach that you and I are familiar with, that I grew up with, me and my family, is called allopathic care, right? Now, the approach that I aim to make you more familiar with or reveal to you that it exists is called salutogenic care, right? Now, let's break down the key differences in a way that makes sense and then discuss when it makes sense to utilize one over the other. I have my handy dandy chart right here, which is going to be a compare and contrast of the two different approaches of health, right? Allopathic, salutogenic. We're going to make our way down the list. So, allopathic care is what you and I are familiar with. The main goal, the main intention and practice with allopathic care is going to be to fight disease and relieve signs and symptoms, right? So we're all really familiar with this. You're sick, you've fallen ill, something is going on, you go to your doctor. Hey doc, I'm feeling terrible. Can you help me? Can you give me something to take away my signs or my symptoms? We're all familiar with that, right? Of course. Now, salutogenic care has a different goal. The goal of salutogenic care is to restore health and increase adaptability of the body, right? So we're not trying to fight a disease. We're not trying to relieve sign or symptoms. We're trying to increase your body's ability to work, right? What a brand new idea. Actual application, the actual clinical process that happens in the daily activity in the office or in a hospital or what have you, in the setting of an allopathic doctor, is going to be to diagnose a pathology and treat the pathology with either drugs or surgery, right? So you present to your doctor. The doctor says you have X, Y, and Z, and this medication or this surgery or this treatment is a really good treatment for X, Y, or Z diagnosis, right? Again, we are all very familiar with this approach. In contrast, salutogenic care, and if you haven't noticed by now, chiropractic care, we don't want to diagnose symptoms. We don't want to diagnose disease. What we want to do is amplify the health of the body. How does that work with chiropractic care? Via making sure that the nervous system, the master control system of the body, is communicating properly to the body. If we can make sure that that nervous system is communicating properly, our goal is accomplished because we want to amplify health naturally without the use of drugs or surgery, right? So this is really our ballpark. As far as salutogenic care goes, chiropractors are not going to treat you or diagnose you. They are going to make sure that your body is functioning to the best of its capacity, right? Finishing off with the allopathic doctor, if we take a 30,000 foot view and just look at what's actually happening, what is the compass, right? What is the goal? What is the big idea of allopathic care? And we can discuss this. We can definitely discuss this. But if you analyze how an allopathic doctor or an allopathic service, approaches, it's going to be as if health comes from outside the body, right? So you lost your health, I lost my health, I go to my doctor, and it's as if we treat it as if you need someone outside of you, someone else, or you need something else outside of you, which is going to bring health into your body, right? Does that resonate with you? Does it not? Something for you to think about. Salutogenic care in a chiropractic setting, we approach people and their care with the understanding that health comes from inside the body, right? So every human being, whether they're 4 hours old, whether they're 100 years old, has an innate wisdom inside of them. It's a natural, normal thing. It keeps their heart beating. It keeps their lungs breathing. It heals a cut on the skin whenever you cut yourself. And it's within everybody, right? And so this is the key differences in the two different ideologies, the two different practices varying, and these are available to you, right? Those are the two different approaches to healthcare, right? One we're very familiar with, one is possible you may never heard of this, right? But again, maybe one resonates with you more than the other. Regardless, let's give an example of one case seeking care from either side of the coin, right? So let's give a person presents to an allopathic doctor, right? For a wellness checkup, their doctor does their exams, their checks, and the person, for the most part, is fine. At least they're fine symptomatically, but there is a sign, right? That doctor took their blood pressure, and their blood pressure is a little bit high. So there's no there's no symptoms, but there is a sign. Now, that doctor is going to say, hey, your blood pressure is high. We're going to diagnose you with hypertension, maybe stage 1, maybe stage 2. But irregardless, here is some medication that is really good for reducing blood pressure, right? And we're going to reduce your blood pressure to textbook normal, right? So the textbook is going to say 120/80 is your normal. It's supposed to be your normal blood pressure. You're above that. We need to get you down to the textbook level, right? Now, here's the funny thing. If that blood pressure comes down, mission accomplished, right? That is a good result for that doctor because he wanted to reduce your blood pressure with blood pressure reducing medications. And if it goes down, job well done. He got a good result. He or she got a good result, right? That they accomplished what they set out to do. Now, on the contrary, right, that same patient presents to a salutogenic doctor, call it a doctor of chiropractic. Doctor does his exams, his checks, make sure everything is safe, everything presented, same conclusion, right? Patient has a blood pressure that is relatively high, right? Now, the difference between the salutogenic provider and the allopathic provider is that salutogenic doctor is going to start asking questions, either internally or to his patient, basically investigating, right? Why would this person in front of me have high blood pressure? Is this their normal? Not their textbook normal, so not the textbook that they never read, but is this normal based off of their age, based off of their lifestyle, right? Another question. Is there something else going on in the body that can contribute to this, right? So somebody with heart issues, well, the heart is connected to every other part of the body and they all work together. So is there something bigger picture happening here? And internally, what I'm asking myself is, if the body is intelligent, and we know that it is, your body, my body, everyone's body is very, very intelligent, more intelligent than any doctor that I've ever met. If the body is intelligent, what could be causing or contributing to make the body not function properly, right? If the body's intelligent, why would it not act intelligently? That's the question that a salutogenic provider is going to be asking. Now, chiropractically speaking, our job well done will not come from diagnosing or treating cardiac problems, right? That's not even within our scope of practice. That is illegal for a chiropractor to do, and with good reason, because it's absolutely incongruent, right? Because treating diseases is not our goal, okay? Our goal is accomplished, our job is well done when we can amplify and restore the normal, natural health of the body, right? If a person with high blood pressure is able to increase their adaptability, increase their function, increase their resistance, what do you think is going to happen to their blood pressure? Something for you to think about. Now, the point of this comparison is not to steer you away from medicine and steer you toward chiropractic. That's not what this is about. There is a time and a place for both, believe it or not. And by understanding when it is appropriate or when it makes sense to seek allopathic versus seek salutogenic care, you can really skyrocket the health of you or your family and ultimately be empowered, be educated on what the right thing is to do. Now, When is the right time to see a chiropractor versus to see an MD? I think a better question to ask is, when is the value created the highest, or when is your life impacted the most, right? Approaching the question this way, we are basically looking at two ends. We're looking at two extremes where the utilization of the two is ideal, when in reality, of course, we know that the two are utilized in various situations, but we're going to be talking about the ideal where you get the most bang for your buck for yourself, for your family, in an effective and an efficient way, right? Now, let's point out the obvious. If someone has an emergency, they have an infection, a heart attack, a stroke, a severe trauma, an end-stage disease, of course, that is where allopathic care shines the brightest, right? Because extreme measures need to be taken to meet extreme demands, right? Now, for example, if my body or your body or somebody else's body is being overcome by a pathogen and a severe infection is pending, you better hope that you have the strongest drugs, medications, antibiotics available to you pretty soon, right? Because in that situation, it makes sense to utilize those outside in measures, right? I think we could all agree there. Now, in that medical situation, in that medical emergency, salutogenic care, that is not the right time for that, right? The approach of being proactive, of getting adjusted, of having a clear nervous system, a clean, health conscious diet, a routine of exercising. It's not the right time for that. It's too late, right? So allopathic care shines brightest when it is taking somebody that's near death and making sure that they don't die, right? That's when there's the most value. That's when life gets impacted the most, right? On the contrary, salutogenic care, if you couldn't tell by now, chiropractic care, shines brightest when it is used as a preventative measure, right? If you want higher adaptability, if you want higher resistance, if you want higher function, if you want decreased susceptibility to your environment, routine chiropractic care is the way to go. A person with no symptoms, no signs, no disease, no ailments stands to gain a lot from a doctor of chiropractic, because what we aim to do is restore and maintain the natural, harmonious health of the body. Okay? And that's where the most value is gained. Do chiropractors help people who have symptoms and signs and have diseases? Yes, absolutely. And we even handle cases really well, cases that don't really respond to traditional allopathic care. We do. Now, does allopathic care serve somebody who really just wants to promote their health and live to their highest capacity? Can allopathic care help someone like that? I'll let you be the judge of that. Now, I'll leave you guys with this. Again, this is not a anti-medicine, pro-chiropractic talk. This is just giving you kind of two ideas. Hopefully one resonates with you, or maybe you were thinking, oh man, I'd like to be more natural. I'd like to do things different, but I don't know what that looks like, right? I'll leave you with this. Allopathic medical care is life-saving care. There's no doubt about it. Salutogenic chiropractic care is life-generating care, right? You be the judge of when one is right for the other. Let me know if you have any questions. I'm here for you, and I'm a resource for you guys. So thank you guys for watching. Thank you guys for listening. I hope you guys have an awesome, blessed day.